And Froedtert Health announced today they signed a letter of intent to merge as one organization. Both organizations say they want to expand access to as many patients as possible and build 2 new campuses. Our Jason Zimmerman listened to the announcement today and joins us now. So Jason, any idea why this merger is taking place?
Well, we got a little bit of a clue this morning when the CEOs from both of these healthcare organizations sat down for a joint news conference. Obviously, they are touting the benefits of being able to expand their footprint in Wisconsin, offering their patients more services within the same system without having to go outside the system to receive care. Also, they say it'll help in recruiting, bringing in more workers and being able to offer workers more incentives. Another thing here that a lot of people are talking about is a bigger system is going to have a lot more leverage with insurance companies. Obviously, these healthcare providers, they have set rates that are negotiated with many insurance companies. The bigger company you are, the more leverage you have in being able to negotiate the best possible rate that you can charge for services and be reimbursed through these insurance companies. I'm going to point out one other thing that also came up in the news conference. One reporter was asking about Froedtert's earnings from last year, where they reported back-to-back losses that were in the $1 million range. That question was asked if that was a factor in needing to do this merger. Obviously, Froedtert responded, no, it is not. They said this is something where they just simply decided that these two companies are a good fit. They've been partners here for some time, and they just thought that they could complement each other in a way, and that earnings report had nothing to do with it.
And this doesn't just happen, so there's still regulatory approval that they do need. What are the chances of that happening? Are they positive it will happen?
They do believe this is going to go through, and a big part of that is because they're in separate areas of Wisconsin. ThedaCare has most of its hospitals and facilities in the Fox Valley. Meanwhile, Froedtert is in the Milwaukee metropolitan area, so there's not a lot of overlap here. So they believe it'll easily meet the requirements to gain regulatory approval.
So ThedaCare is deeply rooted here in Neenah, dating back, more than a century. Will they lose that name?
A long time. Yeah, that was a question that I asked today.
Okay.
I wanted to know what's going to happen to the ThedaCare name. That is still being worked out and decided at this time. They know there's going to be some type of new name as these two companies come together, but both ThedaCare and Froedtert have deep histories in both of these communities. They want to try to preserve that in some capacity. The big question, though, right now is what that capacity might actually be, and that's going to be likely answered before the end of this year, because that's when we expect to have this merger complete and them to actually go forward on a launch of a new healthcare organization.
All right, time will tell. Thanks, Jason.